All right, everyone, let's go ahead and get started. We're going to be talking over the next 2.5 hours about drug cost reporting. I'm just kidding. We're actually not talking for 2.5 hours. We're going to see what we can do in 40 minutes. Now, with that being said, probably 30 minutes that I'll go, and then you're going to have a ton of questions, and then we're going to go for a little while until we give up. Now, well, let me just go. We're just going to kind of start to dive in because there really is a lot that I want to be able to cover today. Before we start, the general disclaimer, right? This is for general guidance purposes only. This is not tax or legal advice. Direct those questions to your legal and tax counsel. Now that we're past that, what are we going to be talking about today? We're going to be talking about the drug cost reporting requirements that are under the Consolidated Appropriations Act, and transparency and coverage is where this typically kind of falls. We're going to talk about what this reporting is, when is it due, who does it apply to, who's responsible to do it, what is the reporting, what's the data, what are the risks, all of that kind of stuff. So obviously there's a whole lot to hit. So a lot of you folks know me. That was really interesting. I love to take a look at the attendee list, or the people that are registered list. And then I looked in there and I thought, man, this is about as diverse as it gets. So I mean, I literally had to make some notes. There's a number of just direct plan sponsors, and some of you guys I know, and some of you guys I don't know. For the ones I don't, I'm looking forward to talking with you. There's a ton of brokers, and for you folks, a lot of folks know that I was a broker for a long time. I had an agency. I sold to Gallagher in 2011, and then started building different types of services in or around the employee benefit industry. There's TPAs, there's PBMs, there's specific vendors that work on manufacturer's assistance program. There's other cost containment vendors. There's a lot of people, and there's also a lot of people that know me in different areas and aspects. There are a number of people. There are a lot of people that know me from ACA Reporting Service. That's a company that we still own. This all falls under the bucket of healthcare reporting, because ultimately that's what all this stuff is. But we do a lot of compliance services. So a lot of you guys are actually clients of ACA Reporting Service. We have a lot of clients that are part of that we do mental health parity from NQTL analysis. Of course, we're talking about drug cost reporting, and there's a lot of clients that are self-insured reporting clients. And so you start to think about this overall reporting, and you go, all right, let's just think about this in general. This is going to require data and analytics, as well as understanding compliance. And when you really get into the guts of this reporting, you start to understand a lot of it is like herding cats. It's coordination between data that has to be taken in from the plan sponsor and the TPA, as well as the pharmacy benefit manager. And if there's a manufacturer's assistance program vendor, we have to pull that data in too. You got to work the data, and then you ultimately have to get it reported out. This is also different. This is much more akin to ACA reporting, in that the data is due. You have to send it in, right? So like on mental health parity, there's no due date. There is a due date. It was a long time ago, right? We're way past having to have a comparative analysis, but it's not time and date stamped. In other words, like if you're with ACA reporting, when you're sending that in, you either make the deadline or you don't. That's the same thing here. So it's a little bit of a different animal in terms of compliance. But that's how we found ourselves in the middle of it. We're not talking about all this stuff other than you see some people see me and go, what is he doing? It's all the same thing. It's all the same company, just different divisions underneath the overall holding company. All right. So in December of 2020, Congress passed the Consolidated Appropriations Act, and a portion of that obviously is that the reason we're here today is that insurers and plans must submit cost data on pharmacy benefits and drug costs annually. One more thing that I should have said before I even got in and started reading this. In your questions, or maybe I did say this already, this is all I do is sit around and talk about this stuff. So I think I might have said this. Just send in your questions and we'll get them responded to, because and that'll also include a copy of the presentation. That's a very common question people have. Yes, we are recording this. If you'd like a recording of it, we can get that to you as well. Just want to make sure I got that. So you can go ahead and start sending those questions in, and then we'll get to them as we get to them, or we'll get to them after this session. And so this is this new reporting requirement. They say that the intent of the reporting is to ensure that they have enough data around prescription drugs, really to fully understand where the money is being spent. I have had an opportunity actually to talk with the head attorneys at HHS and CMS who are in charge of this whole thing. I can tell you that that really is their intent. I mean, their intent is to gather as much data. Like, kind of, and the conversation is really interesting. They're really great people. And they said, listen, we understand that the reporting is going to be tough because there's a lot of people that have to be coordinated. So my first thing is that, this was a long time ago, but I was like, are these dates going to move, or is this just going to go away? And they were very clear. They said it was almost impossible to get the dates moved to what they are moved to. And so, and that basically what it came down to is you cannot manage what you are not measuring. And if we don't have any measurement in regard to what's going on, we just need more transparency so that we can figure out legislatively if there are things that we can impact. And that's where this is coming from. And the reporting obviously is drug cost reporting. It's actually healthcare cost and drug cost reporting, but we call it drug cost reporting because that's what everybody refers to it as, right? You're going to have the 50 most costly drugs, the 50 drugs with the greatest increase in expenditure. This type of reporting is data that's readily available to PBMs. It's not that big of a deal, but as you continue to move forward, what you find out is you go, oh boy, this is actually going to require a whole lot more coordination. This is the drum that I've been beating for quite a while. And for the TPAs, as a broker, I hammered on TPAs, but I've gotten to know TPAs a whole lot better. My goodness, they've got a whole bunch on them. When you start thinking of all of the different pieces of compliance that have been thrown in your lap in the last 2 years, there's a lot. And oh, by the way, you're dealing with 1-1s right now. Hadn't been that long since I was a broker. And then you have shoppable services coming up, which, as a side note, there's some interesting things happening. Stay tuned. If you're interested in solutions in and around shoppable services, send a message in and I can get you some information. There's a really good product that we're going to be partnering on that's what I think it's seen is very affordable. And there's another one that we're going to partner with that's incredibly robust. It does some really awesome things. But so that's the kind of stuff that you guys you're focused on trying to do this. And here's just another reporting requirement that requires a lot of coordination. We're going to get into the guts of these files, but ultimately what this is that it's going to require a whole bunch of coordination between everybody. The reporting is done based upon calendar year, and we're reporting for the 2020 and the 2021 calendar years in December of this year. Okay, December 27th of this year. One thing I want to do. Can't find it. I was looking for. I have like a little pointer thing, but hopefully you can see that right there. By December 27th of this year. Then we have to turn around and do reporting again for this current calendar year by June 1st of next year. And then this becomes every year, ongoing. Now, this date, y'all, was really problematic. It's going to be tough enough to get all the reporting done this year. And our industry is ridiculously unprepared for this right now. Again, what I do inside our organization is I take on the new stuff, and people know I've said it a bunch of times. I take the ball from one end zone to the other 20. And so in the inception of stuff, and so this is me. This is what I'm into while I'm doing all day long. I can tell you we are so far behind. It's unbelievable. The tricky thing that we deal with is because of the volume and everyone continuing to wait till the last minute is making sure we have enough staff to take care of even clients, which if you don't know in time, you don't have the staff. And so that's the big concern I have is how do you pull this off? Because in the reporting, when we start looking at the files and stuff, you have to look at this based on what they call like a 12-15 basis if you're thinking about stop loss. Claims that were incurred in a calendar year and run out through the end of March of the next year. Now take this ongoing, okay? 2022. We have to wait until the end of March of next year to start doing the data reporting. And oh, by the way, they have to have it by June 1st. That's 60 days. That's tight. Not to mention, if you are dealing with PBM rebates, you're not even going to have the rebates back in from the fourth quarter of the prior year. So I was really bringing up a lot of these things, and I was like, it's just unrealistic. And they said it's in the statute. There isn't anything we can do. We haven't seen anything in terms of good faith effort yet. We do have our pulse on it and are hoping that. And again, this is not legal advice, not all the rest of that. It is my belief that at the end of the day, one way or another, there's going to be some level of good faith effort. As for what that means, I don't know. A lot of it ends up, whenever you get into that, like with our ACA experience, you've got to, it's about substantiation. It's tricky even to make sure that you're hitting those bars. So who has to do this reporting? This is fully insured and self-insured plans. However, the fully insured plans, the carrier is going to handle that. And so if you're a plan sponsor on here, certainly there are some, you may even have some on here that are just fully insured. You were fully insured the entire year. What's probably going to happen, ultimately, you're still responsible, but the carriers are going to do it for you in those type of situations. It's the self-insured groups that you're responsible for your own reporting. Now, as a broker and a TPA, what does that mean? That means you're responsible, because that's leads come with the dog, right? That's just kind of how it is when you're dealing with that. There's no exception for small plans, which is a little disappointing. Again, I understand what they're trying to do now in terms of getting data and what can they do legislatively, but it's tough on small plans. So if you're a self-insured group that's 40 lives or 20 lives, you have to do this. Level funded, minimum premium, everything. MEC plans. Do you have to do MEC plans? I don't know. I'm trying to get an answer on that. I still don't know. To me, it doesn't. In some case, I could make an argument for it either way, but I don't have a clear answer as to whether or not. And so we've submitted that in, and they're pretty good though. Hopefully we'll hear something in short order. I know that's not the majority of the people that are on here, but there are some people that I'm hitting with all of those kind of things that I've tweaked this presentation just a little bit. The plan sponsors, you're responsible, right? You hold the ultimate responsibility, and of course, it's a shared responsibility. Bottom line, for fully insured, they're going to hammer the carrier. The carrier is going to do what they're supposed to do. They're covered by state law, no risk of preemption. They're going to do what because of state laws, right? And insurance commissioners and all the rest of that. It's the self-insured group and the stuff. The reason that SIA, right? There's a reason we're all here. All right, so what is this reporting? The reporting is 10 different things, thus herding cats. There's one plan level file. We'll get into greater detail on this. There's 8 different data files and then an overall narrative file. What you're going to find is that for certain files, the PBMs have most of the data, most, not all. Some PBMs say, we have all the data. No, they don't. No, they don't. They have most of the data for data files 3 and 8, except in very rare situations. Now, and most of the time they'll have it, but there's a decent amount that they won't. TPAs are going to have to assist with certain pieces of the data files, specifically data files 1 and 2. And the plan sponsor has a big piece of data that has to be filling in the blanks as well. And these things are like dominoes. They feed off of one another in that well, I'll get to the next slide when I start to rant a little bit, or the slide after this, a couple slides after this. If a plan sponsor has multiple TPAs or multiple PBMs in these calendar years, there's a lot more complexity. Why? They all have to report. So if somebody moved to your TPA 7/1/2020, July 1st renewal, then you might not have to worry about the first 6 months of that, the other 6 months, but they do. And there are rules, like there's these instructions, like if you've ever read ACA reporting, it's a whole lot like this. These instructions talk about how you go about doing it. And that's the big challenge that anybody has when they're trying to develop solutions like we have to build something like this, is that you have to understand compliance. You have to understand that all the way down to the plan sponsor level. If we not cut our teeth on ACA reporting, there's no way we would be able to pull off what we're doing in terms of this. but there's added complexity there. And what you're trying to do, wearing the compliance hat, is you're just trying to make sure that you get your clients taken care of. And you're building processes and you're building software to streamline as much as you can to make it easy, and so that you can actually pull it off and get it done. There is a major marketplace problem. There are a lot of PBMs on here. I'm begging you to please, if you're one of these, please, coach your folks to not say this to people. What PBMs are telling clients and brokers and TPAs, I hear it literally almost daily. We have drug cost reporting covered. We have it covered. No, you don't. You don't have it covered. You have your part covered. And so what's happening is that it has confused the what out of people, because they've heard that so many times. I've heard it in the past 14 days, I've heard from major PBMs, one of them, we don't have to do this anymore. This was, drug cost reporting was delayed indefinitely. They're talking about something completely different. They're talking about machine readable files. They don't know what they're talking about. That one rep, again, like there's people, the higher level people in the organization are, certainly they're in the loop, but it is just confusing the hell out of everybody. Excuse my French. They don't have it taken care of. They have their piece of it taken care of, thank God. And we'll go into the details of even what that means. So that's one of the things that we do. We have PBMs that are clients, and I'll talk to you uniquely. I want to try to hit like how we're uniquely hitting each of, as long as we have time, kind of what's the world look like from a PBM's perspective, or a broker or a TPA. So I think we'll be able to hit that. All right, so take a screenshot of this if you haven't already. This is what we're looking at, y'all. These are plan list files, these are data files, and these are narrative files. All right, so dominoes, if I mentioned this earlier, it's all about kind of like dominoes. We're gonna hit the first domino first. It's the PBM files. Is that teal? My wife was here, she'd tell you what color that is. I think it's teal. Those are PBMs. So you'll see there, what is the PBM really responsible for? The 3, 4, 5, 6, 7, and 8 files. These files that are in this area. See, this is what I was looking for, my little red pointer thing. D6, 7, and 8. Those are the things that they are responsible for. And why do I say that they have most of the data? They have most because in some of these calculations of the data, and the data is not ridiculously complex. It's not that hard. There's some idiosyncrasies in it, but it's not awful. But one of the idiosyncrasies is about savings from manufacturers' assistance programs. Overwhelming majority of the time, they do not have that data. And so that's why when I say that the PBMs have most data, they don't have that data. We have built other ways to capture that data, and some of this we have a little bit of a leg up on in the industry, because a lot of people know self-insured reporting. We're integrated. We're receiving data from just under 100 different TPAs and over 40 different PBMs. So we understand a lot of the data that you do have and that you don't have. And so now there's other things. There's this narrative file. I was explaining to somebody, it's like the narrative file. It's kind of like, how did you come up with what you're doing here? It's relatively simple. There's a couple of things in terms of the PBMs that they have to include in this about basically what's the description? How are you doing what you're doing? All right. And so we have the manufacturer's assistance programs, kind of the first domino, and then we get the PBM files. Okay. Then, so when we have it all taken care of, Yeah, you have your whole part taken care of, but guess what? From a broker standpoint or a TPA perspective, who are they going to blame? They're going to blame you for sure. This is really a side note, but if you don't know what a fiduciary attestation is, that's another piece of this legislation. Plan sponsors are now having to sign and send in on an annual basis a fiduciary attestation that they're doing everything that a fiduciary should be doing under their health plan. And so it's like the level of scrutiny and the level of seriousness continues to ramp up. And we all know that if this reporting doesn't get done, my time as a broker is going to fall back on you. And of course, what are you going to do? You're going to hammer your TPA partners. That's the way that it works, right? So the goal is, how in the world do you avoid all this stuff? So you go, well, what is the challenge? Some of the challenge is that you have to have data from the plan sponsor. You can't just take data from the TPAs. We have TPAs that are our clients at self-insured reporting. We have all their data on all their clients. we still can't do the reporting unless we go other steps, and we have built methodology, built software to be able to capture some of this other data. But these are, you know, the D1 file, the D2 file, and the overall plan level file. And so that is the lay of the land, clear as mud, I would imagine. But take a snapshot of this, because I think this is kind of helpful. And you know, again, if you want a copy of this presentation, you know, shoot it to us, and we'll follow up, and we'll send you that, as well as answer your questions. Okay, so how in the world, you know, do you kind of get this stuff taken care of? We're going to get into that, but I want to hit something real quick because I'm seeing this a lot in the marketplace. Let's talk about the PBM's perspective and the way to look at life. I'm going to be as careful as I know to be, because this is like a minefield for people like me, in that there's just so many interests that you're trying to just be honest and tell people what you see, but you're also trying not to alienate or make anybody mad at you. Let me explain what some PBMs are doing. Some PBMs, like some of this data in here, all right, this transparency, some of this specifically in this D6 file, there's some data in here that, depending upon what that data is, it might not be good if a broker saw it, okay? And so specifically, now, if you're disclosing compensation appropriately and you're doing all that, hey, that's what people signed up for. And again, I am Switzerland. I don't care one way or another, but I'm just pointing out the realities of what this piece is. And I'm specifically going to go into this D6 file. And what we're seeing in the marketplace is some TPAs, or PBMs rather, because they're the first domino. We're going to come to the TPA, but they're going, all right, we're going to give you a couple of options. One option is we're going to charge you to do this D3 through 8, this piece of the reporting. Some of them say we're going to charge you something that's negligible. We're going to charge you nothing. Or we're going to charge you $1,000 or $1,500 or $700 or something like that. And what they're saying is we're going to report on your behalf in aggregate. That is a key phrase right there that means nothing until you know what it means, okay? We're going to report this in aggregate. Option 1, option 2, we got you taken care of. It's either going to be free, it's going to cost maybe $500, $750, something like that. Or option 2, it's going to cost you $2,000 to $5,000 and you can report yourself. Now think about that question. Does that question not sound strange? I was telling somebody, you know, and of course I know the details of this reporting, so I started laughing. I was like, oh boy, I know what that means. That would be like someone saying, I tell you what, we'll cut your grass, Mark, for $50. But if you let us wash your cars, we'll only charge you $10. You go, that doesn't make any sense. Like, why would you're doing more work. Like I would obviously, you know, and so it's, this question itself doesn't make sense. But as you start to dig into the reality of what the difference is between reporting in aggregate or reporting yourself as a plan sponsor, you're going to understand the difference. This is what reporting in aggregate on your behalf looks like. The aggregation rules are tricky, all right? You have to aggregate by state. When you're aggregating, you have to aggregate by TPA. There's also special aggregation rules that if you are a PBM, you can't report this data in a less granular fashion than the TPA reports. There's just a lot of coordination, y'all. But specifically what I want to bring your attention to are these right here, okay? This is in the D6 file, bona fide service fees, PBM spread amounts, and total rebates on drugs, in this case for this TPA that were not passed, that were just retained. A year ago, I didn't know what a PBM spread was. I just fall on the sword. A PBM spread, though, I guess my best explanation for what I understand it to be is they bill the claim run $200 for a drug, but they send off 180 to the manufacturer. You know, it's like there's a spread that's kept there, and these are these are service fees and such that they're getting that you might not know about. And so you think about, like, if you're a broker, again, you know, for better or worse, that's kind of the way my brain works a little bit because I spent too long doing it, or a long time doing it. You can't do anything with this data. So, because when you're looking here and you go, well, I don't know if that's my client. I mean, is that a lot? Is that not a lot? Doesn't matter. I don't know. But this is the cheap option that they would obviously, I would think that, it's certainly more simplistic in terms of reporting. And again, in Switzerland, I'm not saying anything about it's trying to do anything incorrect, but this is what it looks like when it's your data, the more expensive option. You get your line item. I just know as a broker which one I would want. It may be more expensive, but at least you would know what it is that you're paying. So I throw that out there, but regardless, that is just one element of this D6 file. But you have to have this D6 file and you have to have it done before we can get to this D2 file. The D2 files and stuff is the aggregation, again, can be sort of tricky because you're aggregating based on state and based on size of employer, and then of course at the TPA level you're doing based on that. But then you start putting on your hat, as an ACA company, having that experience, and I go, okay, what about aggregated groups? What about groups that have multiple entities that are covered on? I mean, you saw how many different entities we even have. As we're not a massive organization, but lots of different entities. How do you deal with that? Everyone's on the same medical plan kind of deal. So it gets to be very, very tricky, and the answers to how you pull it off ultimately end up coming to be about streamlining data and what is the most efficient way to herd cats. Again, this being so much like ACA reporting, we spend so much of our time educating people that this isn't going away, that you have to do this, and we're just educating the entire industry at one time. It certainly feels that way. What are the risks? I mean, the risks are that it's time state that it's stamped. There are the basic IRS penalties for doing anything, incorrect. State penalties would be on the fully insured stuff. There's certainly audit scrutiny because, again, this is all going to be linked back to the 5500 plan number and the EIN of the employer with a chunk. You either got it in by that date or you didn't. It's a whole lot like ACA reporting. When you go to, you've seen shameless self-promotion down here at the bottom of each side, drug cost reporting. You go to drugcostreporting.com and it will show you kind of like the world in terms of these different entities and the way that we're looking at it. And that's what I want to look and see the question. I mean, there's just no way I can kind of get to all the questions, but I want to scan to a few of them. One of them is, do we have to still file? Oh, I didn't even hit this. This is actually a really good question. Do I still have to file the P file, the plan file? Yes, the P2 file. The P1 and P3 files are not going to be applicable to anybody that's on this webinar that I think. You had other questions about what if you're on a renewal date and a 12-18 contract? Yeah, right. And so it all becomes about paid claims when you're doing these calculations. And so we're looking at incurred and paid dates based upon essentially looking at it at 12-15. It would not be a situation where it's gonna match up with your stop loss contract, and then that's completely fine. Yeah, I mean, let's see here. Fully okay. Yeah, okay, all right. So I'm trying to think if I can even hit which ones I can hit, because some of them are pretty dense type questions about which files. I think one specifically is they're asking, why would PBMs not have this data? PBMs don't have, I'm not aware of any TPAs that send medical claim paid files back to the PBM. So when you're looking at, in terms of spending category, this is where the D2, this is where healthcare spending comes out. We have to report primary care expenses, specialty care expenses, other category expenses, employee contributions. There's a lot of stuff in there that PBMs would not have any of that data, because that's not really what they do. A PBM, for all intents and purposes, is a TPA for pharmacy-based drugs. One of the changes in the instructions actually was that prior, they updated them into June, is that we were having to do some really funky stuff with drugs that were not filled at a pharmacy. Mercifully, a lot of that went away. But that's the reason that that they would not have that data. Okay, so here's the world in terms of these different entities. Let's talk about, first of all, let's talk at the PBM level, because it really does sort of go in this order. The PBMs, you know, they're just trying to sell new business. Like we have PBMs that are clients, and how our world of working with them is that we consult with them and we help them figure out, you know, make sure that they have all the data and they understand the calculations and all the rest of that. But the bigger thing that we help them, you know, is understanding that we have a software platform that's built that can be launched out at the TPA or plan sponsor or broker level, that's branded to them, and that we have a team that's able to actually take your stuff and the TPA stuff and the plan sponsor stuff and actually get it reported. And that's where we're finding some benefit with PBMs, specifically in going from there to the TPAs that they work with and going, okay, like we have all their data. How can we be of assistance? And you know, we know we can be helpful to some people, but of course not everybody. That's really where the PBM's role sort of ends. And then you think about it like from a TPA and a broker, you kind of go, ugh, but this just fell in my lap. Because if you're a broker, it's always in your lap. And if you're a TPA, the broker, you know, you're just in the thick of it because you have the remaining data for P2 file, D1 and D2 files. But you're also going to have to get this additional data from the plan sponsors. And that is really the tricky part that makes this reporting a lot different, in that if you're not set up and done that like a whole lot, and high volumes compliance, it's just tricky because you have to have methodologies that, you know, you're going to have to talk to the broker of that client. You're going to have the webinar to explain to them. It's just a lot to do. And so that's where we're really partnering at the TPA level, where we're having a lot of success, candidly, is we got ahead of this and built software, you know, and so that we're able to launch that software out that is branded like to their logo and colors and gives that experience of, you know, and we're capturing, you know, the information that we have to specifically from the plan sponsor, very much like what we do for ACA reporting. And then we're able to take that back in and grab that PBM data as well as the TPA's data and then get the reporting done. Brokers more are, it just depends, right? Because there's a lot of brokers that are just very consultative. There's an increasing amount who understand where some of the stuff is just going to fall through the cracks. Let me give you some examples. A lot of the bundled ASOs, like I mean, you know, right? The bundled big guys, to where bundled meaning they process the claims and they also own the PBM. They have all the data, right? Now, there may be other reasons. Get here. There may be other reasons to report in aggregate, right? But regardless, we'll just assume that that's not the reason. But yes, they would have the data to be able to do reporting. But think about the situation where not everyone was with the same PBM and ASO or TPA for all of those periods of time, the 2020, 21, and 2022 calendar years. You have people moving vendors. So you got, okay, well, that's tricky. You have to work with multiple vendors. You've got some PBMs that are saying, we'll do it for you. Have others that are going, hey, we got your files. They're in your portal. Just pick them up. And then, you know, you can file them yourself, which means it's going to fall right back onto the broker. And so a broker's role, in my mind, it sort of depends. At kind of the lowest level, it's helping a client understand what this is and they have to do it. I mean, I would like to think that either a broker is figuring out some solution to get it done, or they're pushing the plan sponsor directly to like our platform to where they can just pay directly. And then we'll take care of plan sponsors directly. That's not the majority of our distribution, but we have the ability to do that. But you know, beyond that, there's some of them that are going, well, what we're going to do is we're going to contract directly with drug cost reporting, and we'll just, we'll build the client, and we want to be more involved to make sure. We don't want to be more involved, but we know we're going to be more involved whether we want to or not. And we're going to dive into it that way. We, in terms of pricing, what we do, the website says $19.99 per reporting year. So that's really what we do on there. If a plan sponsor comes directly to us, that's what we charge. We do less than that for TPAs. And, it really sort of depends on the size of the TPA. And as plan sponsors start to get later in the year, we just kind of raise that a little bit. It's not going to be anything egregious, but we're trying to very much mirror, again, we understand compliance. And so we're trying to mirror the 5,500 type reporting. We feel like we can pull it off. It's tight, when you're starting this, simply because you're educating the entire world about how this all works. But that's kind of, and all this pricing and stuff is transparent. It's on the website, and the branded. It's interesting. I just got to. All right, so we're back here. I'm not going to say who this. I'm not going to say who this is, but they said that there is an entity that's charging, and I'm not sure if this is that. This is, I guess, for maybe a TPA. I'm not exactly sure. But there is one of those bundled organizations that this option is free. This option is $75,000. Okay, if you see that, just go. This is like my children's excuse. It's like my 14-year-old's excuse of why he didn't turn his phone in at night. Like, do what now? It doesn't make any sense. That doesn't make any sense. And that would make, in fact, that would make me more want to go, what in the world is here? If that ends up costing that much. So, and obviously, the whole point here, because I know a couple of people that are asking questions about that. If you're aggregating, if the PBM is aggregating at the entire TPA level, then you're never going to see all this stuff. That's the point. Is what is this worth? I don't know. It depends on what's there. And again, I'm Switzerland. I don't care. And it's not like brokers are smart. Brokers are real smart. They know this stuff, and they have compliance teams, and they're figuring it out. All the rest. So I stayed to 40 minutes. I'm trying to look through here and see if there's a handful of more questions that we have that that are maybe good ones, conducive to answer in this kind of environment. Yes. Yeah, I'm looking at one. This is like our portal. It is branded. It does go out. But if you didn't want if you didn't want your TPA brand logo and all the rest, that's fine. We just do it towards ours. Yes, we do everything. We file it. We do everything. We have a team and the big thing, again, I can't stress this enough because I've been stressing this to clients and people that we work with. I can do it. We can do it right now, right? And as long as we staff, but if you don't have enough people, you can't do it. Meaning, if people just wait to the last minute, I promise you they are going to wait to the last minute. This is ACA reporting all over again. We were actually revisiting this week some old videos to where, like, we had our kids, like we had everyone stuffing envelopes to hit that date, at midnight. It was interesting and fun, but pretty nuts. It's going to be the same kind of thing. But yes, we do all of it. Yes, there's one question about the how do we typically work in terms of the data? There's a couple ways that we get involved. A lot of the stuff that we're finding at the PBM levels, the PBMs, they kind of got their arms around that level of it. And what we're doing, like with the TPAs, typically is we'll take a de-identified claim feed. Now, if they're already a current TPA and we already have their data, this is not PHI, which is nice, right? So we don't have to worry about all that stuff, but we can take just basically a de-identified claims run, and then we can do all the manipulation of everything, because we're going to have to take place of service codes and provider taxonomy codes and do some of this kind of working and stuff. Then we got to get the data from the plan sponsors, their employee contributions, the way their corporate structure is set up. What are they doing for telemedicine, telebehavioral health, virtual primary care, direct primary care, manufacturers assistance programs? You got to kind of look at all that as well. Stop loss premiums, there's a question. Yes, stop loss premiums are also one of the pieces of data that we collect that are reported, I believe, in D1, maybe. I don't think it's in D2. I think it's in D1. ASO fees, those also have to be, but that's stuff that we're capturing at the TPA level. Now, plan sponsors, do we provide reports by plan sponsor? Yeah, absolutely. If we have the data, for sure, we are doing that. Yes, we do request the data directly from the PBMs and the TPAs when we're contracted at the plan sponsor level, and and it's we get your contact information, right? We get that basic contact information. The best situations are, most TPAs are going to have some level of they have to come up with something so that they can take care of clients. But I'd anticipate they're going to have some way. At least I would press them. The big concern that I have is that the longer the focus stays on 1-1s, hey, and I get it. I spent a long time, in this industry. It's 1-1 season, but this isn't going away. And there's a certain period of time you will not be able to get it done, period. You just won't be able to get it done. There's another question about fees per plan. No, God, no. We don't do that. It's just the entire plan sponsor, not, so if you have 3 plans, is a really good question. So if you had 3 medical plans, no, we're not looking at your low, medium, and high, no. But yes, we also request the data directly. There's also a couple of points about that folks have talked about, PBMs that said, like, maybe the PBM isn't really trying to hide something. There is more to it. I didn't get a chance to read them all, but I am Switzerland. I am saying there are some people, there's some that is their, it's just like anything, if you can, some people are going to find ways, maybe frankly, like every one of us, right? Certainly like me when I was a kid, and certainly like my kids, you're going to find a way to what's sort of in your best interest. There is more to this aggregation. The rules here are tricky in that if you can't, like, now there's the one rule I do want to make sure, because it looks like this person understands this pretty well. If the TPA reports in aggregate here, the PBM can do whatever they want to do. That's buried in here in the regs. And so if the PB or the TPA is reporting in aggregate for all their groups with one PBM, and they're doing that for each one of their separate PBMs by state, the PBM themselves can choose to report either this way or this way. Doesn't matter. The only catch is that if instead the TPA or the TPA is reporting not in aggregate, then they can't. It's a very good point. And again, we all know that there's, some of this stuff is reality. And again, hey, to me, if people know what they're paying, that's not my battle to fight. But very, very good point. And I hope that I addressed that, because there was a couple of people that ended up mentioning that. So that's kind of how that aggregation. And again, there's some of my answers that might not make fully sense based on some of the questions, and we'll make sure that we get some responses back out to you. All right, I'm going to try to end it there, just because I don't want to beat a horse to death. Drugcostreporting.com. You can call us. You can send us an email at support@selfinsuredreporting.com. And we'd love to, talk to you. And I would just encourage you. You got to come up with a strategy, though. You got to figure out, how you're going to do it, you know, how you're going to end up pulling this off, and the sooner the better. So thank you guys. I appreciate it again. There's a whole lot of people on here it's so diverse. It's really tricky actually. But we're, you know, again, we're partnering with all ends of this spectrum. PBM clients, we have a lot of TPA clients. More and more we're contracting directly at the plan sponsor and certainly at the broker side, and would love to work with you guys any way that makes sense. Thanks. Have a great day.